I'm Christopher Spears of Our Revolution, Massachusetts, a progressive organization of around 16,000 Massachusetts residents, and we're pleased to offer testimony in support of Bills H 1267 and S 766, an act establishing Medicare for all in Massachusetts. As has been noted in Professor Gerald Friedman's report on the financing of a state Medicare for all plan, this bill would establish a Massachusetts Healthcare Trust, which would finance medically necessary care, including but not limited to dental, vision, prescription drugs, long-term care, medical devices, mental, behavioral health, physical therapy, and rehabilitative care. This comprehensive coverage would be delivered with no premiums, deductibles, or co-payments. This trust would be a single payer program on behalf of the Commonwealth with the ability to negotiate the cost of drugs and procedures in the same vein as the Veterans Administration, and therefore have the ability to provide Massachusetts with lower medical costs. I have family in Louisiana, which includes a young cousin with type 1 diabetes and other members who put off dental work as a result of not being able to afford it. As a result of Louisiana Governor John Bel Edwards accepting Medicaid expansion, my cousin has been able to have longer hospital stays in a hospital when needed, receive equipment to help with his diabetes, as well as training on how to use that equipment. This helped illustrate to me the improvements in quality of life that an expansion of government benefits can have for people I care about. It also shows the life-changing potential that a state or national expansion of a program, which includes free or affordable dental and vision, and what it could do for the people of the Commonwealth. The Massachusetts Healthcare Trust would also save money by lowering administrative costs. Per Professor Friedman's July 2021 study, in our current system, private health insurers spend around 15% of their premiums on administrative activities and overhead, compared to around 2% for Medicare. If hospitals and physicians are able to send all their bills to one payer, in this case, the state public health insurance plan, this will relieve them of the need to juggle different forms for up to hundreds of health insurance companies, meaning each doctor and healthcare practitioner would be able to spend less of their time on paperwork and devote more time to actual care. The Massachusetts Healthcare Trust could also be used to combat racial disparities in healthcare. Just as the 1965 implementation of Medicare led to the desegregation of U.S. hospitals via threat of the withholding of Medicare funds due to enforcement of Title VI of the Civil Rights Act, the negotiating power of the Massachusetts Healthcare Trust could also be used to force compliance with anti-discrimination law, implement anti-bias training where necessary, and ensure that all Massachusetts patients receive quality care regardless of race, gender, or sexual orientation. In addition, Medicare for All would remove the need for unions to spend a considerable amount of their time and resources negotiating for comprehensive health care during collective bargaining, since it would already be provided by the Commonwealth. This would free unions to focus on achieving better pay, working conditions, and other benefits for their membership. It is for these reasons and more that we of Our Revolution, Massachusetts recommend that the Joint Committee on Healthcare Financing report the bills H 1267 and S 766, an act establishing Medicare for all in Massachusetts favorably. Thank you for your time and attention.